Hi, this is Colleen Parsons with part 2 of the lecture for thorax and lungs. So subjective data is really important, and as in everything, cough, shortness of breath. So you're asking your patients, if you notice that they're having a cough, you're going to ask them questions about it, shortness of breath, chest pain with breathing, history of respiratory infection, smoking history, always asking about a smoking history until people don't smoke anymore. But now we also have to ask about vaping, environmental exposure, and self-care behaviors. So a cough is very important. How long have you had it? When did it start? Was it gradual or sudden? Are you on any new medication? Are you coughing up any phlegm or sputum? If so, how much and what color is it? And if they can cough up some for you and show it to you, all the better. Are they coughing up any blood? Are there streaks of blood, or is it frank blood, meaning actual clumps of blood? Sometimes clots. Does the sputum have a foul odor? What do you notice? How would you describe your cough? Hacking, dry, barking, hoarse, congested, bubbling? Give them some ideas with this. And does the cough seem to come and go with anything? Does activity make it better or worse? If you're lying down, is it worse? If you're sitting up, is it better or worse? Do you have a fever, congestion? Are you able to talk while you're coughing, or does your cough come on while you're talking? Do you have any anxiety about your cough? So you're asking all these questions. There are some medications actually that produce a cough. Lisinopril is one of them. That one of the side effects is a dry cough, sort of like a cough that you might get with a hay fever or something like that. So prescriptions, are you taking any prescriptions for your cough? Do you use a vaporizer? Do you use essential oils? Does rest help? Does your position change help? Do you have any pain? Do you have any ear pain? Do you get exhausted or tired when you're coughing? And are you concerned about it? When you're coughing, do you get any shortness of breath? And then we go on to shortness of breath. And all of these questions are equally as important. What brings on your shortness of breath? How severe is it? How long does it last? Older people are going to naturally have more shortness of breath than younger people. So a small child will say, yes, I get all out of breath when I run around the house 3 times. So you have to determine, is this normal or is this abnormal for the person? Is there a wheezing sound? Do they have a bluish color around their lips? How about their fingernails? Are they bluish? And their fingernails are going to tell you a lot. On the test, there was a question about clubbing, when the fingernails actually get thicker and rigid and they bend over a little bit. I don't know if there's a picture in here, but there was a picture in skin, under skin, and that is clubbing, and that is always associated with lung and cardiac problems. Do episodes seem to be related to food? Shortness of breath is a big deal for people, and people with emphysema or COPD, they just cannot breathe, and they get to a point where they can't breathe, and they're in and out of the hospital all the time. So helping them stay out of the hospital is a huge part of our health care as nurses. Do they have a history of respiratory infections? Do they have bronchitis, emphysema, asthma, or pneumonia? What other kinds of lung diseases might they have? Have they ever had tuberculosis? Do they have a smoking history? Do they smoke cigarettes or cigars? Do they smoke marijuana? At what age do they start? How many packs a day do you smoke, or how many cigarettes a day do you smoke? For how long? Do you live with someone who smokes? Secondhand smoke can be just as impactful as primary smoking. And there's even some study being done on third-hand smoke. So the residual that's left on the walls and furniture in a house or a car. So when somebody leaves that or sells it, can that be dangerous? And the research is proving that it can. Environmental exposure, things like asbestos causing lung cancer. There are different kinds of things. Were they in the healthcare profession, and did x-rays impact them in any sort of a way? And then patient-centered care. Are they getting a routine TB test as needed? Do they get chest x-rays as indicated, especially if their TB test is false positive? They're having a reaction to the carrier agent or whatever. And have they had their flu and pneumonia immunizations? The questions for children are very similar. We're really looking for allergies in the family. Children always have, especially small ones in daycare, will have runny noses, and it just seems like they hardly ever stop running. So does a child have noisy breathing or wheezing? That wheezing, or have they had periods of croup? Those things are very important. Childproofing their house so that that child isn't swallowing any toxic substances, very important. And are there any smokers in the car or home with the child? That can bring on asthma. Have you noticed shortness of breath? Again, for the aging adult, it's the same. Do they have any chest pain when they're breathing? We'll cover all these in the next part. Okay.